This is a short topic to finish off Unit 1, Section 3, the ageing process and its effects on the musculoskeletal system. We are going to have a quick look at the skeletal and neuromuscular changes that come about with age. There is little we can do about ageing, and scarily the impact on the body starts far sooner than you might think, although extremely slowly. From around 35 to 40, gradual loss of bone density will begin. If you start this process from a healthy standpoint, i.e. having strong bones, then this shouldn't be much of a problem. That, along with continued healthy lifestyle, ageing will have less of an impact on the skeletal system. Osteopenia is a condition where bone mineral density is lower than normal. This can be detected by having a bone density scan, DEXA scan. This condition is considered a precursor to osteoporosis. Medication can be taken to help reverse this condition. Osteoporosis is a condition where there is low bone mass. This will lead to higher risk of fractures. Both males and females can suffer with the condition, but it is more common in females. As you are aware from your Level 3 Anatomy and Physiology, osteoblasts build bone and osteoclasts break bone down. Certain hormones are required to promote the activity of osteoblasts, among others these being testosterone in men and estrogen in women. As you are probably aware, there is a decrease in these hormones as we age. The body replaces about 10% of its bone a year, and if the osteoblasts aren't building as quickly as the osteoclasts reabsorb the bone, then you will start to get loss in bone mass. Other issues associated with the skeletal system from aging include a reduction in the range of motion at joints, thickening of the ligaments which will impact the joint, loss of elasticity in connective tissue and muscle, again reducing the range of movement, wear and tear of cartilage and bone ends within the joint, leading to degenerative changes in the joint structure, which will often then lead to compensatory issues. Regardless of what you do, this will happen to a greater or lesser extent. You can, however, help to minimise it. This will include having an active lifestyle with weight-bearing activities included and eating a well-balanced diet. This is best started earlier in life, but it will benefit you whenever you start. Finally, on to neuromuscular changes. As we age, there is a decrease in functioning fast-twitch fibres and an increase in functioning slow-twitch fibres. There is also a loss of muscle mass called sarcopenia. There is a loss of motor units which control the muscles, and although there is adaptations to cope with this loss, larger motor units, it will impair function. There is a decrease in the firing rate of the motor units along with other changes. This only scratches the surface of the changes that happen, but it gives you an idea of what is going on. These changes will start to affect some of our basic actions as we get older. Tasks that seem simple will gradually become harder. Many older adults, 70 plus, sometimes younger, find tasks such as getting out of a chair difficult. This is due to age-related muscle decline. Again, we can't stop this from happening, but we can fight it. Staying active as long as possible is really important. The old adage, use it or lose it, is so very true. A healthy active lifestyle will have an enormous impact. I have clients of all ages, some in their 80s, and their abilities really do vary. Genes will play a role, but weight-bearing exercise, an active lifestyle and healthy diet will make a huge difference for many people. You have now completed all of Unit 1, Section 3, and can complete the associated quiz. You can now move on to Unit 1, Section 4, Assessment Techniques.